The topic of this video discussion is Dantrolene, corresponding to Antidotes in Depth Chapter A24 in Goldfrank's Toxicologic Emergencies. The learning objectives for this session are that you'll be able to describe the pathophysiology and clinical features of malignant hyperthermia, but you'll notice that nothing's in blue or bolded, so this is the less important objective. And that you can also outline the dosing regimen for Dantrolene when used as antidotal therapy for malignant hyperthermia. Malignant hyperthermia is an interesting disease in that it's basically iatrogenic, which is to say that it's caused by medical interventions, specifically by pharmacologic interventions. In humans, there are autosomal dominant genetic mutations, which are not extremely rare, that result in alterations in the ryanodine receptor. Normally, the ryanodine receptor helps muscle cells to respond to nerve signals stimulating them to contract. The figure shown here has simplified what's going on, but ultimately the signal results in calcium being released from the sarcoplasmic reticulum, which allows actin and myosin to interact and cause muscle contraction. Malignant hyperthermia is triggered by exposure to inhalational anesthetics and/or succinylcholine. The altered ryanodine receptors allow too much calcium release from the sarcoplasmic reticulum, leading to too much contraction of the skeletal muscles. The increased contraction leads to muscle stiffness, rhabdomyolysis, and metabolic acidosis, and the increased metabolic work of all of this contraction increases CO2 production and releases heat, leading to hyperthermia. Dantrolene is an antidote for malignant hyperthermia because it blocks the calcium flux through the ryanodine receptor. Less calcium is released into the cytoplasm from the sarcoplasmic reticulum, so there is less actin-myosin interaction and less muscle contraction, hopefully reversing the adverse effects. Most clinical use of inhalational anesthetics and succinylcholine occurs from drugs used by anesthesiologists in the operating room. Because they're the most likely clinicians to encounter malignant hyperthermia, anesthesiologists are trained to recognize it. Indeed, if they see a case of MH, they'll be the ones to order, prepare, and administer Dantrolene themselves right there in the OR. One of the earliest signs you can look for is an increase in the exhaled CO2 levels, as shown in the capnogram. And even though the disease is called malignant hyperthermia, the increase in body temperature takes longer to occur. Ideally, MH will be recognized and treatment started without having to wait until the patient has developed significant hyperthermia. This whole scenario is a situation similar to severe local anesthetic toxicity and its treatment with IV lipid emulsion, where an anesthesiologist is the most likely specialist to encounter a fairly rare iatrogenic complication of the meds they just administered. So they should be knowledgeable about the complication and how to treat it, and should have the antidotal medication closely at hand and start administering it themselves. Dantrolene is dosed with an initial IV bolus of 2.5 milligrams per kilogram, and this can be repeated every 15 minutes until either the hypermetabolic state resolves or 10 milligrams per kilogram has been given. These patients are going to be admitted to the ICU, and the Dantrolene is continued. The chapter authors recommend either 1 milligram per kilogram IV every 4 to 6 hours, or a continuous IV infusion at 0.25 milligrams per kilogram per hour for the first 24 hours, by which time, hopefully, the patient has recovered. Dantrolene comes in different formulations with different concentrations, and this can affect the amount of preparatory work. The older product, Dantrium, comes in 20 milligram vials, each of which needs to be reconstituted with 60 cc's of sterile water and then shaken. A newer product, Ryanodex, comes in 250 milligram vials, which also needs to be reconstituted, but with only 5 cc's of sterile water. Fewer vials and smaller volumes means that Ryanodex seems a lot more convenient, and that's their marketing strategy. That's all for Dantrolene. I'll be seeing you around.